Thank you. Thanks for all the colleagues across Apollo, and thanks again. This was my wish and desire to have such sort of meeting, and everybody cooperated, and we had great case demonstrations from Mumbai and Calcutta, and exactly showing what needs to be done in these patients. What that thing I've selected is to present. Actually, many things could be done, but I selected one or two important protocols and one or two registries. Hope I'm audible and clear. And for
You're
the
audible.
sake of anything, and I would briefly take you through. And this is what we're trying to network across, and proud to have these all colleagues from various hospitals of Apollos. And I'm always proud to present my fax professional service colleagues. We work like a hub and a team, and in tough COVID times, it has been really helpful. And also to get patients for high-end imaging procedures or TAVR procedures, this goes a long way. And we are always working as a team, though our colleagues work in various other hospitals, was mentioned here, but Apollo works as a hub with spokes and all across. And this has been appreciated by European Heart Journal. Some of you must have seen this, but I always take pride in showing this. And Apollo, Sangeeta Madam, and everybody was also very happy. My other colleague, Dr. Gokul and Dr. Avibathan, are also part of this publication in European Heart Journal. I always feel that this is the way to go, to have a group practice and do what is best, and also have a work-life balance for all the colleagues. It's also good to have collaborations with teams abroad, and we're very fortunate to have, I think, Sushil, Ajay, in spite of all the busy schedules, they logged in because of this. And fax, we are collaborating with Columbia and run this TCT program. I think this man you all know is Dr. Leon, and we are fortunate to do some live cases along with him. And this Dr. Sushil Kodali, I should pay my special regards and thanks for establishing a TAVR program in the main Apollo. He has came here initially and learned a lot of things. And then other thing which we take pride in doing it is the collaborations, how it helps. I just want to show it as inspiration to all others. With Edwards and Columbia, Fax and Apollo together, we run this project for poor pregnant heart women patients. This got published in the Edwards Heartbeat Matters newsletter across the world. And this is Dr. Amisha Patel who coordinates this as a Columbia faculty. It's me. And we done a poor PBMV patient, everything done free, and the screening of this also gets done in both in Gandhi, Usmania, and some of these private medical colleges, and it's taken care by this Edwards partnership. Coming to research presentations, there could be too many, but I've selected the important ones. These have been my passion again before QFR, Favor India trial. I've been always trying to see how best to avoid unnecessary procedures, at the same time do what is right for the patients. And this is QFR goes a long way in doing patient thing right. Many of the times FFR again needs a special wire and other problems. If you can get all the information with the same angiographic views, it was best. So I was passionate about this since last 3-4 years, and now it is coming to real practice. Now the new GE lab which we have, we are trying to get the software installed, and Fax Core Laboratory is acting as a reference core laboratory for this Favor India trial. Apollo, Skims Care, and Covey Medical Center. As we know, stenosis, whether to do it or not, we decide by FFR. But this QFR modality is by taking it to 25-degree different views. You have a computer reconstructs a 3D, three-dimensional artery and gives you FFR values at any particular point of time. And the other beauty is you can actually scroll through at each point, whatever the value you want, you can get it like how we have it in RFR now. And this is how we calculate the QFR value only on angiographic basis, and also 5 French catheters pictures are also good enough, but you need to get a good angiographic pictures. So Favor India protocol, Favor means the online quantitative flow ratio functional assessment by virtual online reconstruction, and we plan to recruit about 300 patients. 36 patients were done before and COVID stalled everything. What we need to assess is the sensitivity, specificity of QFR and FFR with positive and negative predictive values. Inclusion criteria of stable patients or culprit vessels in MI. Exclusion criteria is all mentioned here. I won't go into details, but angiographically borderline lesions of 30 to 90%, reference vessels of more than 2 millimeters, and other poor parameters of aorto lesions, other things are exclusion criteria. So basically, we want to get these values like this, and then we are passionate about this, and we did live demonstration in TCT. Even in that, we were surprised to get this almost the same values of both. Even live transmission, everything gets reconstructed in 5 minutes online, and we got similar comparable values. We wish all our colleagues could contribute patients, and all of us who are planning procedures for FFR, they can be included. Only thing is we need to take two angiographic separate views, and then probably FFR values you can keep it, and QFR analysis you can send those pictures for the analysis to us. All this can be done online. That's another Favor India trial. We wish to contribute significant amount of patients. We request everybody's cooperation on it. Other research protocol which is important is many of the times we see lipoprotein small a is important in an Indian subset of patients, and we do see some patients with high lipid levels when their lipoproteins are done, values are high. This is horizon trial study. Basically, is what is sponsored study. What it tends to do is patients who have very high CVD risk factors and documented CVD who has LPA little a more than 70 milligrams. This is quite high value, but that's what the trial is selected because probably it needs to get into lower. This is injection. This is once in a month mRNA injection. It's like PCSK9 injection once in a month, and then probably it's a huge multi-center trial, 7,860 patients. Just got approval in ethics committee in Apollo. The previous one, Favor trial is already done. Approval is done and recruitment is on. This, I think, probably would be able to start recruitment from next month onwards. These are the two important trials which are on. And when I was fortunate to be NIC chair, this is what we did in 2018. We proved Apollo as the highest volume operator and stands tall above all other centers with 19,681 PCIs, contributing about 55% of the total volumes of the country. But this all happened with 15 centers together when we analyzed, from the NIC point of view, the data together. Others have been much behind with 15,000 plus PCIs. I did try to recommend and see that Apollo Cath registry. I made it prepared, but failed miserably because contributions and entry is not happening. But I again request everybody, probably whoever is interested, can take this forward and have the entry of the each centers. Now, what I definitely want to do is this Apollo TAVI Tower registry. This is again, as we discussed yesterday, if we club all our data together, we would have been the leading TAVI center also in the country, which we are not now. So, but if you have 50, 60 from here and 50, 60 from Chennai, all of them together, we would have had to be in the number one unit in this TAVI registry. Also, we made a very simple TAVI protocol for registry for entry. One is that we wanted to show this live, but this Apollo MedMantra system doesn't allow external access. All of you who have MedMantra passwords can go into MedMantra and click on this TAVI registry button. And then you get initial patient details, all the standard ones, and then echo parameters. What is very important, the bicuspid, tricuspid nature of the valve, and the LV parameters also are important, and annulus measurements are important. These are pretty standard, but quite easy to enter. We didn't want to make it too much complicated also. The CT angio parameters are important. Morphology, again, many of the times deciding on the annulus size and coronary heights, what we all standard, and femoral axis diameters, and the TAVI procedure details. So it would not take more than 5 minutes to enter the data in this. We request again to take this seriously, and whoever is part of it. What I also requested management is once the procedure is done, the techs can enter it, but I request all the colleagues to allow that to happen. So that's about the TAVI registry. We should be doing it. In NIC, we collected about 500 plus patients, happened in 2018, and it has increased to 650 in 2019. We don't have 2020 data yet. And in Apollo, probably we have done about 58 cases. So most of them have been core valve, self-expanding 39 I'm talking about Health City Hyderabad, and Edwards, and 12 and 7 of my valve. Some of them are done by my other colleagues too. And most of them are high risk, and mostly were more than 65 years of age group. We had very good success rate. And this is quite encouraging for all of us to get patients improving dramatically after the procedure. Sick patients, heart failure dependent, improve dramatically with the procedure. I request all of you to take this pathway seriously, registry, and then probably cooperate in entering the data. Then coming to ACS pathway, where every hospital of Apollo can contribute here. This is again being done already in Jubilee Hills Apollo Health City. And we were with COVID times, we went into difficult times, and the door to balloon times were significantly increasing. Then all of us sat together I should especially congratulate our Apollo operations team and Tejasvi heading the operations and many other quality departments and ER consultants and ER head now Tamarish, who actually was quite helpful in organizing this meeting, and all the cardiologists, especially my younger cardiology colleagues, Dr. Sanjeev Kumar, Dr. Ramkrishna, Dr. many other colleagues who actively stay in the hospital, and also our FNB students and the DNB students also help a lot in decreasing the door to balloon times, and the heart team approach is leading to further better outcomes. We have collected about this is ACS activated pathway about 288 patients. If you see it here, somewhere in between June, July, August, September, the worst period because of COVID decreased, and gradually it is now trying to come back and improve the numbers. And the age groups of this probably is 50 to 70 is the commonest age group. We also see some younger patients, and gender, most of them, 75% were males, as seen in many of the studies. And most of the patients of echo had, most of them were having moderate or mild LV dysfunction, and some of them had severe. This is what I wanted to highlight. The door to balloon times initially were okay. We were favoring around what is recommended. This cutoff value is about 90 minutes door to balloon times were recommended. Slightly higher, we did improve before, but this COVID, it became haywire, it went very high. So we wanted to come back, and that's where we were wanting to discuss. And the operations team came back with these pathways. And I'm very happy to say that once the COVID cases decreased in January and February, we had about 24 cases and 34 cases, the door to balloon time significantly less than what is recommended, about 49 and 44 minutes. Just to take you through what has happened yesterday, this is 19th March. Yesterday's case, 27-year-old male. Unfortunately, we do see very young patients like this, presented with interval changes. I have actually highlighted the timings here. This is a sheet which are used in Apollo. Arrival time is 8:20 a.m. Patients of primary PCI is done, and then comes out at 9:40. So that's how it is quite encouraging to have very less time, short time, tight lesion is ready, and post-dilated. Dr. Sanjeev, my colleague, did this, and patient did all right. And then that's how now we all want to come out with this Apollo Cardiology Consultants Consortium. That is, we pledge all of us to decrease these door to balloon times further to less than 1 hour, especially in these post-COVID times. If all of us are together, I think this can happen, and this can spread a word that of appreciation that all of us struggle hard in these tough times of COVID. And I'm very happy again. I don't want to take too much time. I wanted to save some time also. And some of the other newer research protocols which we're working on is something on artificial intelligence, where the artificial intelligence is used to see by the routine CT scans, which are done for the COVID patients, whether calcium can be identified with using artificial intelligence. And also now the calcium score on the aortic valve, TAVR patients, whether artificial intelligence can help in it. These are other things which are being done apart from some of the drug trials regarding ARNI and other things which are going on. I think with this, I'll stop, and I'm happy and request all colleagues to take this seriously and help us in building up these registries and data across all Apollos. Thank you very much. And if there are any questions, I'd be happy to discuss. Otherwise, we'll go on to the presentations. I need to stop sharing, I think, no? Okay. Can we get the gallery view where all the colleagues can see each other? I think any comments or questions from any of you? I see Barua.
Yeah, I think it's a great initiative, Dr. Sreenivas. I'm very happy to see that. I know the year after the academics always. I think I have been thinking. I've been even telling many times. Many years back, I requested my manager when I spoke to Madam also once. The need to have our own data registry and all long back. I think it's not being fulfilled or not materialized because of various reasons. Now we are taking initiative. I think it's a great thing because, as you know, as a Apollo group, we have a maximum number of cases, all complex cases, new cases. Everything is being initiated in Apollo itself. It is a great initiative. I hope we'll be able to achieve the kind of show us this is one of the best group in the world. And we are always there with you, and any help, any kind of required, I'm always there, and we'll try to upload and try to help in this kind of fulfilling this kind of your idea and your kind of targets. All the best. Thank you very much.
Thank you. Sarita Madam, I see She actually requested me to have a live slot for her, but because of obviously you can't have live cases from everywhere, so I requested her to show a case, and probably we could involve more in future. I see Sridhar, I see
Sir.
Rajeshwari. Anybody?
Namaste, family. Namaste, Apollo family.
Good evening,
Namaste.
madam.
Namaste.
Good evening.
Good evening, Dr. Sreenivas, and
evening,
thank
ma'am.
you for having me here. And it's wonderful all the work that you are doing. It is very impressive in spite of the fact that you're so busy. You still have time for all of these things. It's wonderful. All the registries, all that work. It's excellent.
Thank you. Sridhar, you want to say anything, or shall we go for the
Nothing,
last?
sir. It was very good. No, any of that registry also good, no, sir. So numbers are increased. Even the COVID time, I think in Hyderabad we did more cases.
Yes. Thank you. All happens because positive work of all the youngsters who stay
Thank
in
you,
the
sir.
hospital. Thank you.